Kevin Jello. This is the Black Men's Health Check podcast.
His name was Marcus. He was 42 years old. Great job. Coached his son's Little League team on Saturday mornings. Ate decent. Not perfect, but decent. He was tired sometimes, but who isn't? He figured that was just fine, just the grind of being a black man in America. He didn't go to the doctor much. He wasn't sick, nothing hurt, and he had no reason to go. But his company offered one of those annual wellness checkups, and his wife has been on him about it for 2 years now. So he finally went just to get her off his case, just to go get the paperwork done. The nurse wrapped the cuff around his arm, squeezed it, and read the numbers. 60 over 100. The nurse didn't panic, but her face shifted. She said, "Has anyone talked to you about your blood pressure before?" And Marcos said no, because no one had, because he had never been. 60 over 100, stage 2 hypertension. And Marcos had no idea. No headaches, no dizziness, no chest pain, nothing. He felt fine. That's the part that gets me every time I think about this story, fellas. He felt fine. I'm Kevin Jello, and this is the Black Men's Health Check podcast. A show about the health issues that are hitting us hardest and what we can actually do about them. Today, we are talking about high blood pressure, hypertension, the thing that Marcos had and didn't know, the thing that millions of us are walking around with right now. This is episode 1 of season 2. We are starting here for a reason. I want to be straight with you from the jump. This isn't a general health episode. This is specifically about us, black men, because the numbers are not the same for us as they are for everybody else. We all know that. And pretending they are would be a disservice to you and to myself and to all of us as black men, right? Here's what the data shows. Black men have hypertension at a rate of nearly 57%. That's more than half of us. That's not slightly elevated risk. That's a crisis. And by age 55, 3 out of 4 black adults have already developed hypertension. Compare that to about half of white men at the same age. We are getting there faster. We are getting there earlier, and we are paying a higher price for it. Black men are 30% more likely to die from heart disease than white men. Let that land for a second, folks. Not slightly more likely, 30% more. And one of the biggest reasons is uncontrolled high blood pressure. It's the number one risk factor for stroke, and black men have 2 to 3 times the stroke death rate of other groups. 2 to 3 times. Let that sink in. This is not a footnote. This is not a statistic buried in a medical journal somewhere. This is our reality today. And I believe we deserve to understand it clearly, fully, without sugarcoating it, so we can do something about it. The question isn't whether high blood pressure affects black men disproportionately. It does. The question is, what are we going to do with that information now that we have it? That's what the rest of this episode is about. Let's get clear on what high blood pressure actually is, because I think a lot of us know the words but not the meaning. When your heart beats, it pumps blood through the arteries. These are the tubes that carry blood throughout our bodies, right? Blood pressure is just the force of the blood pushing against the walls of those arteries. When your doctor takes your pressure, they give you 2 numbers. The top number, called systolic, is the pressure when your heart is actively beating. The bottom number, diastolic, is the pressure between beats when your heart is at rest. Here's the range to know. Normal blood pressure is below 120 over 80. If the top number is between 120 and 129, and your bottom number is still below 80, that's elevated, not yet hypertension, but it's a warning. Stage 1 hypertension is 130 to 139 on the top, or 80 to 89 on the bottom. Stage 2 hypertension, where Marcus was, is 140 or higher on the top and 90 or higher at the bottom. Write these numbers down somewhere. Know where you fall. Now, here's the thing that makes high blood pressure dangerous in a way that something like a broken arm is not. There's usually no pain, no alarm. Your arteries are under too much pressure, and over time, that pressure damages them. It stiffens them. It narrows them. It weakens the walls, and that damage built up quietly for years, sometimes for decades, before it shows up as a heart attack, a stroke, or a kidney failure, right? That's why it gets called the silent killer, not as a metaphor, it is a clinical reality. And that silence is exactly what makes it so dangerous for us. Because if nothing hurts, we don't go about it. We don't go check on it. And if we don't go, we don't know, right? If we don't know, well, we have already heard Marcus' story. So if blood pressure has no symptoms, why are we talking about warning signs? Because while most people with high blood pressure feel nothing, some people do get some signals, and we tend to dismiss them. That's just the human traits in us, right? We chalk them up to being tired, stressed, or just getting older. So let me put some names on what to pay attention to. Headache, not your everyday stress headache, but a headache that hits the back of your head early in the morning when you're just waking up. When blood pressure spikes severely, some people experience this. Not everybody, but some does. But it's worth noting. Vision changes, blurred vision, seeing spots, or a kind of visual fuzziness, especially when you stand up quickly. High blood pressure can affect the blood vessels in our eyes, and changes, in vision are something to take seriously and get it checked. Fatigue that doesn't match your day-to-day activity. I'm not talking about being tired from a long week. I'm talking about a heaviness, a drag, where your body just, feel like it's working harder than it should. When your heart is working overtime to push blood through those stiffened arteries, it wears out fast, and you can feel that exhaustion in your body. Nosebleeds is another one. Now, this is a little bit complicated because most nosebleeds are not associated with high blood pressure at all. So don't get me wrong there. But frequent, unexplained nosebleeds, especially severe ones, can sometimes, be a sign. And shortness of breath. You're winded doing things that used to feel easy to you. That's your body telling you something is off. So fellas, don't dismiss this, okay? But here's a critical thing I need you to hear from me today. Most men with high blood pressure, and I mean most, have zero of these symptoms. None. That's the whole point. Marcus felt fine, and his blood pressure was 160 over 100. That's why waiting for a symptom to go get checked is a losing strategy. High blood pressure doesn't always announce itself. There's no knock on the door. You cannot feel your way to a diagnosis. The only way to know your numbers is to check your numbers. That's it. No other way. That's the whole formula. Now, let's get into the why. Because the numbers being what they are, they're real reasons, right? And some of them are things we can control. And some of them are things that, were put in us or put on us. And I think we deserve to name both honestly. First, there is a genetic component. Research shows that Black Americans, particularly those with West African ancestry, tend to have a higher sensitivity to salt, meaning the same amount of sodium that might not spike someone else's blood pressure can raise ours more significantly. This isn't a character flaw. It's biology, and it's a biological variation we need to work with, not against. Then let's look at stress. I'm not talking about the ordinary stress, the day-to-day stress. I'm talking about the specific, chronic, relentless kind of stress that comes from navigating racism every day. There's a name for it: racial battle fatigue. And you guys heard me talk about this before. It's the cumulative toll of microaggression, systematic inequity, over-policing, economic pressure, and the psychological weight of being Black in America. That kind of chronic stress keep your body in a state of elevated cortisol and adrenaline. And elevated stress hormones over time raises your blood pressure. This isn't metaphorically. The science is clear, my brothers. Thirdly is your diet and access. Most of us grew up with certain foods, some of them, the collard greens, sweet potatoes, beans, fish. Those are actually great for your blood pressure. But some of the foods that become staples in our communities, canned meats, smoked meats, food heavy in sodium, those work against us. And it's not just about choices. Food deserts are real. Living in neighborhoods where you find 3 fast food spots and no grocery store, that is not a personal failing. It's a structural one. And fourth, and this one matters a lot, the distrust of the medical system. And that distrust is earned. From the Tuskegee experiment to present day disparities in how Black patients are treated and heard, Black men have real legitimate reasons to be skeptical of doctors. But here's what I know. Staying away from the system does not protect us from the diseases, right? It just means the disease win uncontested. I say all of this because understanding the why doesn't mean we are powerless. It means we know what we are actually up against. And that's where it starts. All right, let's talk about what we can actually do. Because this is not a helpless situation by no means. High blood pressure is one of the most manageable chronic conditions there is, if you know what to work on, right? So let's start with food. There's a way of eating called DASH diet. That's a DASH. It stands for Dietary Approach to Stop Hypertension. It was designed specifically to lower blood pressure, and research have shown that it works even better in Black adults than in other groups. Here's what it comes down to in plain terms: reduce sodium, increase potassium, and cut out processed food as much as possible. Sodium, the American Heart Association recommends staying under 2,300 milligrams a day, ideally 1,500 if you have hypertension. For reference, 1 teaspoon of salt is about 2,300 milligrams. 1 can of soup can have anywhere from 800 to 1,000 milligrams. A fast food meal can put you over your daily limit in just one sitting, right? So what do we eat? Glad you asked. More potassium: bananas, sweet potatoes, beans, spinach, avocados. Potassium literally helps your body flush out and relaxes the walls of your blood vessels. And a lot of our cultural food are already rich in potassium. Beans and greens, sweet potatoes aren't just comfort food. They're actually medicine for your blood pressure. So what to watch for? Watch out for the canned meat. The sodium in those, man, is significant. Smoked meats like ham hocks and neck bones, have tremendous flavor, but also tremendous sodium. You don't have to eliminate them. I'm not saying that at all. But just be aware and be moderate when, consuming them, okay? So let's go beyond the diet. Movement. You don't need a gym membership at all. You need 30 minutes of moderate movement most days. Walking counts, and it counts a great deal. A real walk where you're moving and your heart rate, is slightly elevated. That 30 minutes done consistently can lower your systolic blood pressure by 5 to 8 points on its own. Sleep. This one gets really underestimated. Poor sleep raises your blood pressure. If you're getting less than 6 hours regularly, that's working against you. Your body needs sleep to regulate stress hormones and allow your cardiovascular system to recover. Alcohol. I'm not by no means telling you don't drink, don't have a drink. But more than 2 drinks a day raises your blood pressure. And drinking heavily even once a week, what some call, binge drinking, spikes it significantly. If your pressure is elevated, alcohol is working against you, totally. And smoking. If you smoke, your blood pressure is higher right now than it would be without it. Every cigarette causes a temporary spike. Over time, the chemicals in cigarettes damage your artery walls and narrow them permanently. That conversation is worth having with your doctor. None of this is about being perfect, because we are all humans and none of us are perfect by no means. However, it's about moving in the right direction. Small, consistent changes add up in ways that one big, gesture never does. It's the compound movement, right? I want to spend some time right now on medication, because this is where a lot of us, really get stuck. There's a belief out there, I've heard it from men, my own life, in my own circle, that taking blood pressure medication means you have failed, that it means your body gave out. That is a sign of weakness. Come on, fellas. I need you to let go of that idea right now. Please. High blood pressure is not a failure of willpower. In many cases, especially for us as Black men, it's a combination of genetics, environment, and years of accumulated stress. And sometimes, even when you're doing almost right with diet and exercise, the biology still needs some support. That's not defeat. That's just a reality. Blood pressure medication works. There have been studies for decades. They save lives. And many of them have no meaningful side effects for most people. Now, different people respond differently to different medication. That's just in general. And that's real. Some blood pressure meds work better for Black patients than others. ACE inhibitors, for an example, tends to be less effective as a first-time treatment for a Black patient. Calcium channel blockers and thiazide diuretics often work better. This is a conversation worth having with your doctor as well. Ask specifically what's right for you, because you're, as an individual, what works for someone else may not work for you. And based on a race and your full health picture, you may need something different. One thing is genuinely dangerous: stopping your medication cold turkey because you feel better. Feeling better is often because the medication is actually working. So if you stop it suddenly, your blood pressure can rebound fast, sometimes even higher than it was before. If you want to stop or adjust your medication, talk to your doctor first, man. Do not do it on your own, because you don't know the danger you may be bringing onto yourself. Know your numbers. And here we go, here we go again. Write them down. A normal blood pressure is below 120/80. If it's elevated, it's 120 to 129 on the top, 80 at the bottom. Stage 1 hypertension, 130 to 139 on the top, and 80 to 89 at the bottom. Stage 2, where medication is typically recommended, 140 or higher on top and 90 or higher at the bottom. If you're already in stage 2, lifetime changes alone are usually not enough. You need medication and a lifestyle change combined together. Both, not one or the other. Taking a pill to protect your heart is not weakness, my friends. It is the same decision as wearing a seatbelt. It is the same decision as using a helmet when you ride a bike. It is for protection, and the men in your life need you here. Your kids need you, your family needs you, your generation needs you, your community needs you. Take care of yourself is not optional. It is your responsibility to the people who loves you. Let me give you 5 concrete things to do after this episode ends. Not someday, not next week, not next month, this week. 1, get your blood pressure checked. You don't need an appointment. Pharmacies have free blood pressure machines, CVS, Walgreens. A lot of the grocery stores have in-store pharmacies. Even some fire stations will check it for you. If you haven't had it checked in a while, maybe in the last year, that ends this week. Please go and get it checked. Number 2, buy a home blood pressure monitor. You can get a good, clinically validated one for under $30. Check it in the mornings before your coffee, and then again in the evenings for about 7 days straight. Write every reading down. That log becomes the most useful thing you can bring to any of your doctor visits. Number 3, make one sodium swap this week. Just one. Swap a can of soup for some homemade or low sodium soup. Swap, table salt in your food for a squeeze of lemon or some herb. Stop adding salt at the table. One swap done consistently adds up faster than you think. Number 4, have the conversation with your doctor. If you haven't seen one in a while, make that appointment this week. And when you go, don't wait to be asked. Tell them your numbers. Tell them what you have been tracking at home, and ask specifically about your blood pressure risk. You are the one with the most at stake in that room with your doctor. So act like it, okay? And number 5, share this episode with one brother who needs to hear it. You know who he is. He's the one who hasn't been to the doctor maybe 2-3 years. The one who say, I feel fine, I'm good. Send it to him. No explanation needed. Just, here's something you might want to listen to. That's it. That one text could change the course of his life. Okay, my friends? I keep coming back to Marcus. He sat in that clinic room staring at his numbers, 160/100. And he told me later that he felt embarrassed. Like he should have known. Like he should have caught it earlier. And I told him, what I want to tell you right now. You cannot blame yourself for not knowing what nobody told you. You weren't raised in families where we talk about blood pressure at the dinner table. We were raised to push through, to show up, to handle it, to not complain. Those values got us through a lot of hard times, and they kept us out of, the doctor's office as well. But this is where we have to evolve, my brothers. This is where the strength of who we are has to include knowing your numbers, has to include taking a pill if the pill is going to keep us here longer, has to include asking the one question even when it feels uncomfortable. Marcus got on medication. He changed his diet. He walks every morning now, 30 minutes before anyone else in the house is awake. His pressure sits at 118/76. Great spot. He coaches Little League on Saturdays. He's going to see his son grow up. That happened because he went to a routine checkup. You're listening to this episode right now. That's not nothing. That means something in you is already paying attention, already deciding that you matter enough to know what's going on in your own body. You cannot fix what you don't face. But the moment you face it, the moment you look at the number, make that appointment, make the swap, take the medication, right? That's the moment the story changes. I am Kevin Jello, and this is the Black Men's Health Check podcast. The goal going forward is to have a new episode every other Wednesday, or basically every other week, all season long. We are covering 10 critical health issues for Black men throughout this series. Take care of yourself, my brother, and I will see you on the next episode. And remember, your health is your wealth. Peace out. God bless.
If this hit home, subscribe. Next episode coming up next. This is the Black Men's Health Check podcast.